Good evening, everyone. This is Manips and Sips, episode 3 with Dr. Jeremy Boyd and Dr. Brandon Cruz. It's a pretty late evening. It's about 10 o'clock. Just got home from my late day at work, as did you, Jeremy. Right now, I'm trying to relax on my terrace overlooking the city skyline. So forgive me if the wind kicks in every once in a while. It gets a little rustly there, brustly. But I have my drink in hand here. I chose Basil Hayden. This is from Kentucky. It's not the typical whiskey that you have produced from corn. This has a little bit more of a rye mash to it. It's a nice light-bodied, but has a bit of a hint of spice and white pepper finish to it. But I have it on the rocks and looking to get going with it.
All right, and for me over here, I'm on my deck, which is on the second floor, enjoying this gorgeous night. I take that from Brandon once we started talking about the terrace. I had to run out here and join you out here. So yeah, a long day. Busy meeting people, tried CrossFit for the first time. That was actually a pretty great experience. I know there's some people who say CrossFit's dangerous and everything like that, but it was actually a really good experience. I'm glad I tried it. As for me, right now I am drinking John Quad Van Dam by a local brewery called Kelly Green Brewery in Pittman, New Jersey, which is the town right next to my clinic. It is a Belgian quad, and I can say I've never had a Belgian quad before. It's a darker beer, not too hoppy at all, a real smooth finish, and I believe this is 11% alcohol, so it packs a bit of a punch, but goes down real smooth. So I'm excited about having this for this episode here. The episode we talk about the name of the show and everything.
Yeah, so before we really dive into future episodes and the various topics, we figure we pay homage to the name of Manips and Sips and basically talk about what got us intrigued into doing manipulations. Why is it such a repertoire, and our treatment and the way we practice. We obviously have a spinal manipulation course that we teach. So because just kind of want to talk about what courses we've taken and what we like about it, what we don't like about it, and go from there. Jay, you want to, lead us?
Yeah, I guess I'll talk first about the name of Manips and Sips and how we came about with it. I think it originally started with, the corny joke that I'm sure half of us physical therapists say is while we're treating patients and saying, a patient makes a comment, wish, hey, do you want me to do anything? Do you need me to do anything for you? And they're like, oh, it'd be great if I had a cocktail with it. I'm like, my corny joke was always it should be like a BYO or have some drinks during physical therapy. That way everyone mellows out. And I was talking that with a friend of mine and a client of mine, and we were just talking about manipulations, and he threw out the name Manips and Sips in regards to this. So instantaneous, that's awesome. So we had the name and the hashtag for forever, and we decided to make it into a podcast. So it's exactly what I was hoping it to be, is some drinks, and now we get to talk about some manips and manipulations. So actually we did have a couple viewers who didn't know what manips was, and those are the non-physical therapy viewers, which I was excited to hear about. Manipulations is a type of manual therapy where we provide a high velocity, low amplitude thrust, which is just pretty much a quick motion to a particular joint, most commonly known in the spine, is where most people know about them, and it may or may not elicit what we call a cavitation, or what most people know as a crack. So that's typically what we refer to as a manipulation. Brandon, I'm sure, has a better explanation of manipulations, but that's, I guess, in a nutshell what they are. So
I think you hit it right on the head there, Jay.
Oh, perfect. I listened to you a lot during your courses. it worked well. So me personally, in regards to manipulations, why I found them so fascinating, why I apply them pretty much, I would have to say every single day of practice, is that it was probably my first affiliation when I was under, if you listen to other podcasts, or the first podcast was under Terry Andrews, and he was a certified manual therapist through Maitland, and he showed me a couple manipulations. I think the first one he actually showed me was the cuboid whip manipulation of the foot, and the effect that it had on the client. Like, I was hammering home doing the mobilizations or the joint play kind of techniques I was learning from my previous experience being an aide, just watching them, and just from PT school. And he's like, let me show you this, and it had such a profound effect that right there and then I got hooked on it. And then from there he showed me some thoracic and lumbar techniques. So that's pretty much what got me into it. And then residency, as if you hear our other episode, really hammered it home for me, and just seeing the research backing it up. And then just clinically, there's a lot of research out there. Some things they'll say, yeah, that works. Sometimes it doesn't. But clinically, in my own clinic, when I apply it, has been pretty effective. And there have been a lot of times where I've done a mobilization or soft tissue technique, and then I'm like, I'm gonna try a manipulation, and it seems like it's works for me. So it's a matter of applying it when it's appropriate. So yeah, that's my story on manipulations, and I love to perform them, and probably be something in my practice for a long time coming.
Awesome, Jared. Now you've definitely come a long way since we first started working together with the manipulations. But my first foray, I guess, aside from getting them done as a kid or a high school athlete, going to the chiropractor and getting what they term an adjustment. I first got into it in PT school. There was actually a gentleman who was a licensed chiropractor who went back to get his PT license. We befriended each other, and he would not only always manipulate my spine, but he began to kind of show me a couple things here and there. And then as we began to get into the internship or the clinical portion, where I actually got to practice these a little bit more frequently, definitely just kind of hooked me. So if you, for those of you who heard our last podcast about residency, before I even went to residency, we had a small intro into a abbreviated manipulation class, and how to use them, how to appropriately use them, how to definitely apply forces. And we only learned a handful in those 2 days, but like I said last time, Bill Egan and Scott Burns, who are the two PTs that taught us, just knocked it out of the park. Their skill set was amazing, and I was like, I gotta learn what these guys are doing. So I went on to my residency. Like I said, started my residency just so I could learn Manips. Obviously, got a ton else out of it. But since then, I've been practicing about 5 years now. I've taken a host of courses from Manipalooza, which is no longer, sadly, a course, but it used to be basically, it was by Evidence in Motion, EIM. They offered basically 3 days where you go out and you learn manipulations. However, the year I took it was one of the first years where they really began to, that pendulum began to swing towards pain science and biopsychosocial approach. So Manipalooza turned into a little bit more of an encompassing out weekend than what I was expecting. So I was a little disappointed because I went in thinking I was going to get one thing and got something else. But it was also the first time I heard Adrian Lowe speak, and he could turn a boring topic, or what seemed to be a boring topic at the time, into a engaging and riveting one. So I was definitely happy I took that course. Like I said, it no longer exists. They have now switched to the Align course, I believe it is. Another course I took prominent is one of the James Dunning courses. His techniques are very crisp and spot on. works with you on creating a barrier and getting multiple cavitations with each technique that you do. So really refining what I learned with those, year in residency, and then with the Manipalooza course. And then the big one I took, which I'm really glad I did, was the Gibbons and Teahan Master Class course. That was a 5-day course. So Gibbons and Teahan, they are a physiotherapist and a doctor of osteopathic medicine. I got confused there. Osteopractor is James Dunning. So Gibbons and Teahan are from Australia, come around once or twice a year to the United States, and they have their 3- and 5-day course. So I took mine out in Oklahoma about a year and a half ago. Spent the extra money, spent the extra time to be around these basically living legends in my eyes to learn the way they do things. So again, just further refinement of a lot of techniques I already learned. I learned some new ones, but a lot of it was how to make the technique of manipulation, especially spinal manipulation, more comfortable for patients, using a minimal leverage technique where you're not going into end range. I know a lot of programs or a lot of ways it's taught, manipulation is taught, is bring that patient to an end range position or end range barrier, and then you're kind of thrusting through it or plowing through it. Their approach is much more gentler, much more soft. It's much more reliant on speed. So it really, really fine-tuned what I was doing. And then since then, I've been teaching, our own courses. I teach at Rutgers and get to kind of spearhead the manipulation aspect over there as well. So just really, really, you have to dive into it. It's not something you can learn in a weekend and then come out, being an expert. I've taken many courses. I've worked with many people on how to constantly refine my techniques. And you get frustrated those first couple days out. And I find a lot of people tend to avoid manipulations because they come out of the course, they're psyched, they're motivated, they're inspired, and then they try it on their own. And their first couple times, they maybe don't get the cavitation, or they don't feel as confident. And after 2 days, maybe they just think it's not for them, and they go away from it. It definitely takes a lot of practice in the beginning. And a lot of self-reflection and a lot of feedback, from either yourself or if you have a mentor around you or something. So that's kind of where I've been with manipulations.
As for me, I definitely didn't go into as many courses as Brandon did, but definitely lived vicariously through him. And then all the private sessions and the mentorship that you gave me, I learned a lot. I think you gave me some of the best nuggets from those courses. So obviously through the residency, we learned a lot. And then what else? I took the Maitland, so CMMT approach, their manipulations, of course. And then I took the Gibbons and Teahan online course talking about manipulations. I didn't get to go out to the Oklahoma one as much as I wanted to. I think I was studying for one of the board exams at that point. And then also this recently just went to the had a residency collaboration at Philadelphia between UPenn, Temple, Drexel, Jefferson, and McGee. And it was a manipulation kind of course where we all kind of collaborated. We discussed and try to help refine each other's techniques. And it was pretty awesome because it was amongst fellow residents, specialists, fellows, and everything like that. And it was amazing to be able to chime in, help out, even at that level. So amongst that group of individuals. So that's my experience with manipulations thus far, and taking some courses and everything like that. So.
Yeah, I remember that one. That was in the beginning of May. I was a little jealous and envious. I wasn't able to make that. I had a prior engagement I had to attend. But for those of you who are listening and interested in manipulations, if you do get an opportunity, it is a little bit pricey, and especially when you add on airfare and hotel and travel, definitely look up one of the Gibbons and Teahan courses. Like I said, they're only around once, maybe twice a year. And I think it's Arizona and Oklahoma are usually the two places they do it. They're getting older, so I don't know how much longer they'll be doing it. But if you get the opportunity, they have a great course you can take. But transitioning into why I do them, they are effective. They're quick. It's easy for the people who are the therapists, even chiropractors out there who have gone away from doing manipulations or adjustments as termed in other professions. The argument is that it's not effective. The research doesn't support it. It's passive treatment. The research does support it. I mean, we'll probably go into that in some other podcasts. But, if you want to do a more active approach, a manipulation probably takes 30 seconds to a minute. That gives you the rest of the session to do what you need to do. And like I said, the research does really support it. So it's a quick, dirty test, retest, get that patient, doing what you need to do right afterwards and roll them into maybe a more active variation of what you just did on the table. Typically, for example, I'll do a thoracic manipulation, and then I'll have them go and do some active thoracic extension or rotation exercises before I go into, loading that pattern. So in my eyes, we're getting that passive treatment, any neurophysiological effects that may be open through it, and then the next step is to add an active approach where that patient does exactly what we just did, maybe thoracic extensions or rotations on a foam roll to build that pattern. And now we're going to load it with some exercises after that, depending on what they need. So I think we're kind of hitting all the points along the spectrum there.
Absolutely. And I think also on top of that is while you're working, doing these manipulations and stuff, you get the patient to the table. That's when you can throw in your education. I mean, me personally, when I'm doing my exercising or anything like that, either too focused on the exercise itself, and it's a tough time to give that education. So I always think that, when I'm doing my manipulations and mobilizations, this is a real good time to provide that education, build up that therapeutic alliance, make them feel better. And for all those listeners at home, Brandon mentioned the test, retest. A lot of therapists or a decent amount of therapists don't know what that is. Put simply is you find some sort of activity or a painful area or some sort of thing that means something to the patient. Let's say they're hurting at their biceps or anything like that, and you do a technique or you do an exercise, and immediately afterwards you redo that pain scale and see if it made an impact, or you test out range of motion and you do something, and then if it increases, is beneficial. If it didn't get anywhere, all right, maybe you need to modify your technique, or maybe that technique wasn't beneficial. So manipulations are a good way to wham, bam. All right, let me test, retest. Oh, it's an improvement. We know it's beneficial. All right, let's continue on with the rest of the session as Brandon was discussing. So that's what I like to use it for. And I'm a big proponent of education and everything. That's where I've taken a lot of courses. So I think it provides me with that opportunity to do that. And, I think patients come to you versus a personal trainer or, a massage therapist or chiropractor. Oh, you're here to also help, do something to help me reduce my pain, and then show me the way where I can take it the rest of the way with these exercises and drills. So that's how I kind of use it in the clinic.
No, you hit all the right points there, Jaron. Like you said, we have the ability with our profession to kind of dabble in a little bit of everything. And I should probably be careful the way I say that, but you touched upon a personal trainer, a massage therapist, and a chiropractor. And what we're able to do is utilize these tools or these interventions to create a plan of care or a broad based treatment plan. And it's just not one thing. And that's what I think really separates our profession. And profession can be so great if we allow it to.
Yeah, I agree with you. I think we can provide the whole package as long as we do that. I think you mentioned, podcasts is a lot of us or some of us will go down one avenue and kind of restrict themselves. And when we do that, we're kind of, taking away that perk of us where we can dabble into a little bit of things and provide the whole package for the patient. So, hopefully, with some viewers listening in, you can definitely consider these type of techniques, following some classes and training and mentorship, and provide it for your clients.
Yep. So you hit everything on the head, Jer. But I think with that, we'll begin to wrap up this our episode 3 here, and we look forward to episode 4, where we get to dive a little bit deeper into our profession.
Yeah, I think maybe a good way to finish things off here is why don't you talk about lastly, and should be quick, is what is your favorite manip or manipulation for the
what is my favorite manip?
one? If you're stuck on an island, I guess it wouldn't really matter if you're stuck on an island or not, but if you're forced to only do one manipulation for the rest of your career, money maker.
Can I get one a segment? Because
I
don't know, man. I used to be very, very big on that prone CT junction. That was when I first learned that was like my go-to. Lumbar. Oh, I'll leave it at that. The prone CT junction. I say if that's done right, that's a nice one. That clears a lot of things up in that cervical and thoracic area.
So now I'm thinking back. I'm like, wow, I screwed myself over with this question, because now I'm thinking the same way. I'm like, I at least need one per area, but I'm the knucklehead who asked the question. So I'm a huge fan of CT junctions, as you know. You see me in the clinic there, but for purpose of one, the name, the first manipulation I learned, and how effective when I use it, I'm gonna go with that cuboid whip manipulation. Yeah, right. A foot one.
Good for sprained ankles. Good for sprained those chronic sprained ankles. Those are great for those.
Ankles, or those plantar fasciitis that just don't get better, and you get your palpation and you're like, wow, this isn't really on that plantar fascia origin there, and you slide off. It's at the cuboid, and it's like, all right, I'm gonna be the man who figures this out. So that's always fun, because generally when they get to that point, you're like the second or third provider, and you pull that out, you look like the man. And I only pull that maneuver off when I'm like convinced. I feel that cuboid, it's not moving well, it's tender as hell to touch, and when I pull out, people feel, generally that's like the biggest home run effect. The other point, that my last name's Boyd, and it's Cuboid, and it is the first manipulation I ever had to do or learned to do, and it was my first evaluation as a student physical therapist. And I remember that first day is cuboid syndrome, and my CI was like, you know what cuboid syndrome is? I'm like, I know where the cuboid is, the rest I don't know. So that has to be my favorite overall, but I do love those CT junctions. But I think I'll leave it with whip.
I like it. And I think on one of your Technique Tuesdays, you did the cuboid whip and spelt Boyd with your last name. So I do recall that. It does make sense now.
Yeah. I'm trying to see if I can modify it in any way that I can rename it professionally across the entire PT nation to Cuboid with my last name, but it's a solid technique, so it's probably not gonna. My dream's not gonna happen with that one, but I'll keep.
Now that I know it's your dream, I'll help you, or hopefully we'll be able to help you reach it.
That would be the dream. But I guess that'd be good to wrap up with things. Always closing notes here is that if you have any questions, comments, concerns, or anything like that, or seeking mentorship, or looking for good manipulation courses, or any courses that is in orthopedics and sports, I'm not gonna lie. I don't know about you, Brandon, but I don't take any courses in the neuro, cardio, or any other physical therapy. I keep it to sports, physical therapy, and manual therapy. Feel free to reach out to us. We do have a Facebook page and Instagram. It's Manips and Sips. My personal handles, which I handle them both. My personal one is The Decent Doctor. My business is Trifecta Therapeutics. Feel free to message me on any of those. And Brandon, feel free to talk about
my Instagram handle is Dr._B Cruz. And my business is Pursue PT Now. So you can reach me at both of those handles.
Awesome. How's that drink coming?
I finished a little bit ago. So perfect timing. Perfect timing.
Yep, I just finished mine off, so it's about that time to wrap it up then.
Yes, sir. All right, man. It was a pleasure. Have a good one. Signing off, guys. Until next time.
All right. Bye now.